Dr. David Feinberg has enjoyed an enviable track record of running large healthcare systems like UCLA in Southern California, and more recently, Geisinger Health in northeastern and central Pennsylvania. Geisinger operates 13 hospitals, over 40 clinics, an HMO, the Commonwealth School of Medicine, and 2 research centers. Plus, it has a reputation for adapting innovative approaches for the provision of healthcare. For example, through their Proven Experience initiative, Geisinger patients rate their experience on a mobile app, which offers dissatisfied patients refunds up to $2,000 with no questions asked, except how could they have made their experience better. So why would the CEO of Geisinger move to Google to head their health strategy division? Hi, I'm Amy Grant of the ABL organization, and as a follower of innovators in healthcare, Dr. Feinberg's move to Google was, quite honestly, unexpected. Except that Google has been quietly behind the scenes building a healthcare business, along with the likes of Amazon, Berkshire Hathaway, JP Morgan Chase, and Apple, to jump into $3.5 trillion spent annually in healthcare. According to Dr. Robbie Pearl, the former CEO of the Permanente Medical Group and Kaiser Permanente's Mid-Atlantic Permanente Medical Group, in a recent Forbes article, there are 5 opportunity areas that Google might seize upon under Dr. Feinberg's leadership. First, home automation gadgets that will enable seniors to live more safely at home. Think digital doorbells, thermostats, home security. Second, using self-driving cars to solve a senior's transportation issues and getting to the doctor's office. Third, using big data to improve patient health. For example, Geisinger used technology to keep medical tabs on every single patient within its 3 million person catchment area. Impressive. Fourth, investing in the next gen of wearables and trackers. More than jewelry, they'd actually alert their wearers as to whether they're okay or not. And fifth, to become a world leader in AI, using artificial intelligence to make better diagnoses and potentially eliminate an estimated 30% of care delivery that's been proven to provide no value. One of the ways ABL has been staying on top of innovations in healthcare for the past 19 years is by identifying, acknowledging, and awarding ABBYs to innovators in healthcare service, medtech, and healthcare IT and digital health companies that are bringing innovative approaches and technologies to deliver quality care more cost-effectively. This year, 2 different groups of finalists will present their company's products or services in ABL's 19th and 20th ABBY Award events, located in Long Beach on December the 5th and in San Francisco on December the 12th. Several of the 5 finalists will be presenting at the 19th Innovations in Healthcare event in Long Beach, are bringing technologies blended with human interaction to healthcare. For example, the Catasys On Track program uses predictive analytics to identify behavioral health care avoidant people who are suffering from untreated behavioral health conditions that are worsening their chronic medical disease. Once identified, Catasys care coaches engage these patients to motivate behavior change, resulting in better health, improved resiliency, and reduced cost. On Track's retention is 80%, 4 times the average behavioral health treatment retention. Impediment's SOZO digital health platform provides a critical tool for the early detection, monitoring, and management of conditions like the swelling caused by lymphedema. When used immediately upon cancer diagnosis, SOZO detects lymphedema in breast cancer patients as much as 4 to 10 months earlier than the alternative, allowing for early intervention, prevention of disease progression, and decreasing the development of persistent, possibly irreversible lymphedema by as much as 95%. Psychiatrist Joshua Friedman, MD, developed the Health Piper platform for the nearly 2/3 of millions of Americans who are identified as suffering from anxiety or depression by their PCP, but don't want to travel across town for treatment. Health Piper uses a cost-effective concierge style that harnesses mobile technology, coupled with innovative approaches for delivering meds and staying patient-connected for less than half the typical cost of care. Another finalist, Advanced Pathways' 5-day protocol for hypnosis-combined therapy, provides solutions for patients suffering from chronic pain, like fibromyalgia and migraines. This evidence-based, non-invasive, drug-free treatment option helps get patients out of fight-flight, resets their pain loop, balances the autonomic nervous system, reduces and controls stress and anxiety, increases restorative sleep, and helps with PTSD. It also dramatically decreases the overall cost of their care. And perhaps the most cost-effective of this year's Abbey Award finalists is Amenity Health's Medcline pillow. For under $300, the Medcline Reflex Relief System has been proven to be more effective than medications at reducing nighttime GERD symptoms, which affect 20% of the adult U.S. population. Clinical trials show Medcline is more effective than surgery at reducing silent reflex symptoms, and it provides patients with an effective alternative to PPI meds and surgery to treat GERD. One of these Abbey Award finalists will join our 60 previous Abbey Award winners on December the 5th in Long Beach, and another finalist will take home an Abbey the following week in San Francisco. It's innovative companies like these and the innovations on Google's and Dr. Feinberg's horizon that we'll need if we're going to have the quality of care we've come to expect at a price the country can afford. We'll look forward to having you with us.